Gentleman Fairfax, Mr. Palmer.
Would the gentleman himself rise for purposes of question?
Gentleman yield.
I'll be glad to yield.
Gentleman yields.
Mr. Speaker, I would ask the gentleman that Virginia taxpayers now are paying something like 21 different taxes and fees to support the Affordable Care Act, and those are monies that are going now to the federal government. In order to understand the contrast between the bill he introduced and the substitute before us, can he tell us how many of those funds, the amount of, I understand, about $5 million a day, are recovered in his House Bill 5002?
Mr. Speaker, I think he might be confused. He might mean 5,003. If you're seeing $5 million per day recovered, I think would be in 5,003, not 5,002. So, the substitute that's before us. Is that what you're talking about, or the original bill?
Mr. Speaker, in order to understand the contrast, if I may, to understand the contrast between the two bills, the bill that is before us that's been reported from the Appropriations Committee, to contrast it with the substitute, I'm asking about the bill that came from the Appropriations Committee. How much of the monies that Virginians are paying now into the Affordable Care Act is recovered and appropriated in that bill?
Mr. Speaker, I would say to the gentleman that those taxes are federal taxes that are collected, and there are savings that are included in House Bill 5002 that come back automatically to us pursuant to the actions of the Affordable Care Act several years ago. One is the prescription drug rebate, I believe, and there's some other items that are in savings that are included. But as far as the $5 million per day, we do currently have the 100 to 138%, those 200,000 individuals that are in fact eligible for that coverage are eligible for subsidies, very significant subsidies, up to $1 billion, I think, in that regard. So if those individuals choose to sign up, which they can if they're in the 100 to 138%, then there will be dollars coming back in the way of subsidies to those individuals, I'd say to the gentleman.
Further question, Mr. Speaker.
Will the gentleman yield?
Be glad to.
Gentleman yields.
Mr. Speaker, I ask the gentleman if those persons who do not qualify for the subsidy and are persons then that fall in what people are calling the coverage gap, for whom the monies have been collected already from Virginians, how many people in the coverage gap are covered in House Bill 5002 as reported from the Appropriations Committee?
I would say, Mr. Speaker, there is no expansion of the coverage gap in House Bill 5002.
Further question, Mr. Speaker.
Gentleman yield.
I yield.
Gentleman yields.
Then do I understand the gentleman that the major contrast between the bill that's appropriate from the Appropriations Committee, I reported to the floor, and the substitute before us, is that the substitute bill appropriates the money that's been collected from Virginians to provide expansion of Medicaid and presumably ensure, as much as I understand, as much as 250,000 individuals who are now uninsured, but that the bill from the Appropriations Committee covers none of those individuals.
Mr. Speaker, I would say to the gentleman that if the premise is that a dollar for a dollar were to come back to Virginia, that could be true. But when you have a federal government that's $17.5 trillion in debt and is borrowing $50 billion a month and is spending, I think, borrowing 35 cents for every dollar they're spending, I would say his analogy is not a correct analogy to use.
A further question, Mr. Speaker.
Gentleman yield.
I'll be glad to yield.
Gentleman yields.
But, Mr. Speaker, I'd ask a gentleman, aside from the $1 trillion deficit that you're talking about from wars that were not funded, a few little activities that undertook in the federal government, isn't it the case that the Affordable Care Act had within it a funding plan that would allow the program to be funded out of those monies and not to affect the federal debt?
Mr. Speaker, I'd say to the gentleman, the Affordable Care Act, when it was first passed, had a lot of provisions that many of them have been delayed because of how badly it has been rolled out. I think there's 16 or 17 or 18 provisions that have been actually delayed because those in Washington who passed it knows it's something that is not working. And I would say to the gentleman that if you look at the budget, the substitute that is before us, that you all are actually saying it's a better budget, I want you to go to page 516. I want you to look at lines 19 through 21. And if you don't mind doing that, then I'll read it to you what it says. And this is language I don't know that I've ever seen in a budget bill to kind of show the clarification between the two approaches to governance. The Director of the Department of Planning and Budget is hereby authorized to transfer appropriations among agencies and programs as needed so as to implement coverage for newly eligible individuals pursuant to 42 U.S.C. 1396 DY1 2010 of the Patient Protection and Affordable Care Act. I don't know that I've ever seen a broad authority given to the director of DPB to take monies from any part of our budget to try to make a program work. As the gentleman from Lynchburg asked earlier on the number of quote-unquote additional full-time equivalents needed and necessary to carry out this, it's been very vague in the facts that have been forthcoming. And I would say that while this might have, in the words of the minority leader, elegant simplicity, I would say that you could drive a bus through the language on that language of those three lines on page 516.
Further question, Mr. Speaker.
Gentleman yield.
I yield.
Gentleman yields.
Mr. Speaker, while I do not have a staff of experts sitting behind me as the majority party has to be able to assist me in my questions, I would, though, like to know whether or not it's the case that, with all he's had to say, that it's not an uncommon practice for the Appropriations Committee to send out bills appropriating money some sufficient, which essentially means that the executive moves money about from accounts some sufficient to cover that need. But that kind of language is not exceptional at all. It's quite often the language in budgets.
Mr. Speaker, I say to the gentleman, if you're dealing with non-general funds, he is correct. When you're talking about the Virginia taxpayers' money that we collect with the state treasury, that is incorrect. I would say that to the gentleman. And I don't need an expert to tell me that.
Further question, Mr. Speaker.
Gentleman yield.
I'll be glad to yield.
Yields.
Mr. Speaker, the retirement system has been of concern to us for some time. I noticed a sharp contrast between the bill reported by the Appropriations Committee and the governor's bill, and namely that is that $76 million additional money is set aside by reserve payment for VRS. Wouldn't the gentleman agree that that's good management, that's good business practice?
Mr. Speaker, I would say he told me yesterday he got that idea from me, so I think it's a great idea.
Mr. Speaker, that's exactly the point of my question. If I may ask another question?
You sure may.
Absolutely.
Gentleman yields.
The governor has, I think, made an attempt to bend over backwards to say that Virginia taxpayers have paid money that is available to Virginians. He has talked with the majority party. He has tried to be accommodating, and the $76 million is a prime example of how he's tried to bring that about. My question continues to be whether or not it is the case that when we realize that the expansion of Medicaid frees up some $225 million in net savings that can go to items like an increase in reserve payments for the VRS, why is it that the Appropriations Committee chooses to essentially overlook, I'm asking the gentleman, why the Appropriations Committee would choose to overlook a collectible on the part of Virginia of probably in the neighborhood of $2 billion and not appropriate it?
Mr. Speaker, I'd say to the gentleman that I vividly recall 2 years ago sitting on the 9th floor with the Secretary of Health and Human Resources, having the in-depth discussion about the Department of Justice and the settlement that we were entering into. He said and told us that it was going to cost $349 million for that settlement. I looked at him and told him I didn't believe it for 1 minute, that if it was a nickel, it was going to be twice the cost, in my opinion. We got a memo from, I think it was Medicaid, or DOJ, or I don't know who it was, Department of Planning and Budget, excuse me, that said the cost would be $718 million, which is 105% of what was estimated just a mere 2 years ago. So I'd say to the gentleman, I think the Appropriations Committee has taken the prudent approach and doing what should be done in budgeting the dollars as we feel they will be there at the end of the day. And to take what many would consider statements of this money will be there, it's free money, we're already paying for it, I do not think is a prudent approach to take. And as you probably do know, we receive almost $2 for every $1 we send in federal taxes to Washington. And we are the #1 or #2 state in the nation of the receipt of federal tax dollars.
Further question, Mr. Speaker.
Gentleman yield.
Yes, sir.
Gentleman yields.
If the Commonwealth is in fact #1 or #2 in the receipt of federal dollars, and we freely spend federal dollars for our highway programs, for a whole variety of programs, including a program in Medicaid that's gone on for many years, a 50-50 match, I fail to see what it is at this juncture in time that makes this proposal somehow different than the others? If we are able to accept some federal dollars but not others, could the gentleman make a distinction for me in the budget that he has before us as to why it is that we just choose not to accept this amount of federal dollars?
Mr. Speaker, I would say to the gentleman, I think I've repeated it on the floor at least 5 or 6 times, that before I would even consider any receipt of dollars to expand the coverage gap or expand Medicaid or Obamacare, we would have to reform the existing Medicaid program. Currently, it's growing at an 8% rate, and that's about $320 million cost to us. And our revenues are growing at about a $650 million rate. So almost half of our increase in revenue is eaten up before we even start to spend money for teachers, for public safety, for other entities in our Commonwealth. So I think it's prudent to take the approach to make sure that we are reforming a program that has almost 1 million people in it, that costs us 50 cents for every dollar, to get that rate of growth under control so those dollars can be better spent as we move forward.
Further question, Mr. Speaker.
Gentleman yield.
Yes, sir.
Gentleman yields.
Mr. Speaker, I understand the gentleman was part of the Merck Commission, if I'm correct in terms of what that acronym is, looking at how Medicaid reforms might be brought about. I have understood from the conversations and the news accounts that I have read that we have in fact moved forward on the reforms that the Merck Commission had recommended. Can the gentleman give a specific recommendation for reform that's not already been undertaken?
Mr. Speaker, I say to the gentleman he's incorrect. I'm not on the Merck Commission, but I'll be glad to answer his question. What, in fact, we have done, there were, I think, 3 phases or 3 stages, 3 phases of reforms. And they've done what many would consider the easy parts, which are the 2/3 of the population, but are 1/3 of the cost. Just started the dual eligible program about a month ago, and that is a demonstration project. And those that I have talked to, some are involved in that, have readily acknowledged they probably will lose money on that endeavor. And that is a quote-unquote pilot program. And so 2/3 of our cost that we spend is not currently under managed care, or quote-unquote has only been under managed care for a month. And I need to see real results, that the metrics are being met, to make sure that the costs are under control before we would actually proceed. So we have not done the ID and DD reforms on the coordinated care, and the substitute that's before us does not include that. 5002 actually does. We added 65 more total waivers in 5002 than the substitute that's before us. So I'd say to the gentleman that while the process and the task has begun, it is not complete, and I feel very strongly, based on the track record of what we've been presented with on the 9th floor, that normally when our estimates, that we have estimates, we're off by a good percentage. And so I'm not comfortable moving forward until we have the reforms in place and be working for at least 12 to 18 months.
Further question, Mr. Speaker.
Gentleman yield.
I yield one last time.
Gentleman's yielding the last time.
Mr. Speaker, I know we all show concern about our first responders. We share concern about our ability to pay our employees adequate amounts, our university faculty, our constitutional officers, our teachers, and so on. I would ask the gentleman, in sharp contrast with the bill that the Appropriations Committee has reported, sharp contrast to the substitute that provides a 2% salary increase for state employees and so on, and $17 million for the Line of Duty Act, why it was the case that the Appropriations Committee, in the bill it reported, chose not to give a 2% raise and chose not to put the line of duty back as a state responsibility.
Mr. Speaker, I'd say to the gentleman that we had a 1% bonus and a 1% pay raise. So we have the equivalent of the same dollars invested in quote-unquote employee compensation. That's an easy calculation to do in a conference if the Senate would sit down with us so we could have a conference, but that hadn't occurred. I would say to the gentleman on the Line of Duty Act, he might be aware I had a JLARC study this past session that ended, that was passed. That was agreed to by the first responders and some of the local governments, and it's a 2-year study. And they're going to look at all the factors dealing with the line of duty. Several years ago, we actually, in the line of duty, as you know, it first started out as a death benefit for those who were killed in the line of duty. It's now morphed over years into a much different program where the costs have escalated, and about 2/3 of the cost in claims are at the local level. So I think rightly so, several years ago, we actually split that out. And part of the agreement on my resolution, we are going to look at funding issues in that. I think it would be premature to have dollars in this budget until JLOC had completed their work.